Well, Dr. Anthony Harris is the Chief Innovation Officer at WorkCare. It is a workplace healthcare advisory company. He advises business on how to stay open safely during this pandemic. Welcome. Good to have you with us, Dr. Harris. Tell me, I'm not sure I'm hearing your side of the conversation at all here. Let's see.
Okay. Good to be with you, Tyler. Sorry about that.
There, now I've got you. I assume you heard our prior conversation there. Obviously, this is a business woman who has spent her life trying to scrape together the money to open a bar and grill, and now she sees her dreams being pulled out from under her because a governor and the government of the state has decided to shut down drinking establishments again. What do you say to her?
You know, I, as an entrepreneur myself, started multiple businesses. I feel her pain, right? You invest your time, your effort, your blood, your sweat, your tears to bring something to fruition, and you see patrons enjoying it. And then COVID happened, right? And so one of the things that we've been doing at WorkCare is helping businesses like hers be safe in terms of reopening, right? And so I would suggest that we can kind of flip the script in terms of how we look at keeping the public safe as a means to bring in more customers, right? If we're able to put a plan in place that, one, keeps the employees safe of the establishment, and then on top of that, offer a plan that actually keeps the patrons safe. We call it COVID Clear Zone, and it's something we've laid out because we've been doing this since February, frankly, with large organizations to help their employees and to help those patrons that need to come through the door.
Obviously, in a case like in Texas, where the governor has come out and said drinking establishments have to close if they make more than 51% of their revenue through alcohol sales, it's pretty clear cut. You open and you function under penalty of law, and you get a summons and a fine, and you have to go to court and so forth. But let's get over the mountain here and talk about the reopening phase, because it will certainly come. What data do establishment owners need to know and then follow in real time to make sure that they are functioning safely for, as you say, their employees and their customers? What's the data markers?
Absolutely. So the data we need to pay attention to, we've been helping employers with, it's very local, right? There's a metric called R naught, and it stands for essentially a method for tracking how communicative a virus or a pandemic may be, right? And so, for instance, early on, studies from Los Alamos National Institute looked at SARS-CoV-2, and they saw 2.2 was the R naught. Compare that to SARS back in 2003, which was 3.5. And this number is made up of literally the number of contacts one individual has and potentially spreads the pandemic or the virus. And so from a local standpoint, we got to know what the local transmission is in your location. And that's going to help predict to what level you need to protect your workers, protect the patrons, and what measures you need to have in place. So look local, ask, partnership with the local community health department, the county health department, the state health department. These are going to be key factors in understanding the levels of protection necessary.
The number that you describe is basically a multiplier. In other words, one person who has the illness is going to affect 2.2 additional people. Am I understanding that correctly?
More or less. You can distill it down to that simplistically, absolutely. And if you look at pre-publication study out of Yale, they looked at state by state. What's that R value, that R naught, right? And in states like hotbeds like New York, the value was over 6, right? Compared to, like I said, 2.2 early on. And so really focusing in on what's the local transmission, how do we put layers in, and the plan and the onerous nature of it is not too bad, right? We are talking about social
Dr.
distancing,
Harris?
the base. Can you hear me?
I was just going to say, I thought you were finishing there. We appreciate your time tonight. Have a great weekend. Thank you for participating.
Awesome. Thank you so much. Appreciate it.